Aloha, everyone, and thank you for joining the November Hawaii Public Health Training Hui's training today, Bioethics in the Time of COVID. My name is Makamai Namahoe, and I am with Hawaii Public Health Institute. First, I would like to thank our organizers for this training, myself, Makamai Namahoe, Public Health Program Associate, as well as our Hawaii Public Health Training Hui Steering Committee, which compiles of 14 members of all over across statewide organizations. I'd like to thank our sponsors, the Hawaii Public Health Training Hui, the Western Region Public Health Training Center, and the Public Health Learning Network for sponsoring today's continuing education credits. Today, our guest speaker is Linda Axtell Thompson. Linda has 30 plus years of professional experience in the nonprofit management, 25 of those years in healthcare. Her particular areas of interest include ethical issues of aging, dementia, and end-of-life care, as well as the intersect of professional ethics and personal values. Linda is a faculty member with the Healthcare Administration Program at the University of Hawaii, West Oahu. She has served as adjunct faculty in healthcare and nonprofit administration at Chaminade University of Honolulu, and ethics and aging at University of Hawaii at Manoa, and as principal of Axtell Consulting LLC, which offers consulting and training services in ethics and strategy. Linda has a doctor of bioethics degree from Loyola University of Chicago, along with a master's in bioethics from the Medical College of Wisconsin, her MBA with a nonprofit management emphasis from Yale School of Management, and a bachelor's in philosophy from the University of Hawaii at Manoa. So without further ado, I would like to turn it over to our guest speaker, Linda.
Thank you, Maka. Hi, everyone. I am broadcasting from my patio, so you see a blurred out background, and hopefully you will not hear my dogs barking in the background, but apologies ahead of time if that does happen. I'm going to share my screen now, and hopefully you'll be able to see there we go. You'll be able to see my presentation. Trying to get rid of myself in the corner, but I can't. Anyway, actually, yes, my areas of interest are in nonprofit and healthcare ethics, especially in aging issues, and also professional ethics versus personal values. Those are my primary interests. I was asked if I would be willing to talk about bioethics in the time of COVID, and I agreed to do so. In part because there are so many bioethics issues arising and continuing to arise and recirculate. And every day there seems to be a new concern that has a bioethics bent to it as we make our way through this difficult time, the last couple of years of dealing with this pandemic. Over the 20 years I've been involved with ethics, my husband and I would watch TV shows or news and occasionally go, oh, look, a bioethics issue. And these days it's like it's every day or multiple times a day that they come up. So I decided to explore a number of these issues for myself and to try and understand what's been going on with this pandemic from my training in bioethics. And so today what I'm sharing with you are some of my personal views and musings about it. I am going to try very hard to steer clear of any politics because I think politics provides more heat than light. And I think the whole topic has been too politicized already. I will have to touch on the politicization in some form, but not deal with the politics itself, which I find to be more harm than good. So moving into the presentation, what I usually or always like to do when I do ethics presentations is to first start with what is ethics, because many people, including myself before I got into the topic, don't have a very deep understanding of what it is. So we'll do Ethics 101, then we'll talk about ethics as it applies in healthcare and in public health. And then take a look at what's been going on with COVID, some of the ethical issues, some of the many ethical issues that have arisen from COVID. And then looking ahead, are there any lessons to be learned for preparing to be better able to handle the next pandemic? So starting with Ethics 101. Like I said, I like to start with Ethics 101. In fact, I'm going to go back up to this page because many times when I teach, for example, management ethics, people think, oh, it means don't lie, cheat, or steal. And my response is, well, yes, that's where it starts. That isn't where it ends. Or when we're talking about healthcare ethics, people understand that it means you must have informed consent and that HIPAA protects your privacy. And there's not a deeper understanding than that. And there needs to be, in order to understand the nuances and complexities of the conflicts that are occurring. We all have a sense of what we believe is right or wrong, and that sense of right or wrong starts from somewhere. And a part of it is exploring where that somewhere is that underlies our own personal feelings about what's right or wrong. And what I'm hoping will occur in this presentation is that we move away from sort of an us and them mentality or the me right, you wrong mentality regarding ethics to a more nuanced understanding of people's positions, and maybe even find some common ground for trying to find better decisions or right actions as we move forward. So ethics is not the same as laws, morals, or values, although it is very close to those. Ethics is the study of the standards of conduct, of moral judgments and choices, the rules governing conduct, and the theories used to analyze ethical dilemmas from different perspectives. Ethics and law are related, but they're not identical. For example, what is legal is not necessarily ethical, and what is ethical is not necessarily legal. If you think about when slavery was an acceptable practice in society, in the US, England, Rome, Greece, biblical times, it was legal, but from our perspective today, it is not ethical. Also think about things like civil disobedience used to force societal and legal change, where people purposely break the law in order to push an ethical position forward. Or for that matter, think about skirting the margins of legality in order to make profits in business. That's another example where ethics and law are not one and the same. When you talk about morals, ethics is the study of moral awareness or conduct or character. And morals are related to the customs that are generally accepted by society as right or wrong. So again, they are very closely related, but not identical. Values really underlie what one believes to be right and true and ethical. They're a part of everybody's beliefs about what is life all about and what is worth acting on. And we need to understand that there are a number of different values, moral values, as well as economic, aesthetic, or political. And I highlight political because I want to underscore the fact that one's political values will impact what one sees as ethical or unethical in the world. And we need to understand when we have differing values, it can lead to ethical conflicts in other places. Now, there are a number of different approaches to ethics. What do we base our sense of what is right and wrong, what is ethical, and how do we frame that thinking to come up with justifications for decisions of our actions? And these are 5 or 6 of the common approaches to ethics. They're not exhaustive, but they represent probably the majority of dominant positions on ethics. Utilitarian ethics says that it is good or it is ethical to produce the most good or the least harm, or to have the best balance of good over harm, and to seek good, which is seen as happiness or fulfillment for the most people. In rights ethics, you respect the rights of those who are affected by the situation, and their dignity and their right for consideration is based on the fact that they are simply alive and human beings, and people are to be treated as quote unquote ends in themselves and not as a means to another end. Under the justice ethics, the basic idea is that good means people, all people are treated equally or fairly based on some standard. Virtue ethics says that we nurture those habits and traits that enable us to be our best selves. So we would ask the question of ourselves, is this action going to support who I believe my best self to be? Duty ethics says follow procedure, follow standards, do the right thing regardless of the consequences, which is very different from utilitarian, which says the consequences matter, do what provides the best good for the most people. And then common good ethics says that community life in itself is good, and we are inherently communal beings, and that the relationships that we have with each other require respect and compassion for all, particularly the most vulnerable, and we need to consider the conditions of all people involved. Now, you can see there's probably going to be places where there's conflict between different positions or different approaches to ethics. And so there's this one approach called polarity management, which I stumbled across a number of years ago, really when I was looking at decision-making tools. And it asks the question, are you dealing with a problem that can actually be solved? In other words, there is an actual solution, there is a best answer. Or are you really dealing with a polarity that cannot necessarily be solved for all time, but needs to be managed? It's ongoing, it continues to raise problems for people. It seems to be dealing with independent opposites. And if you favor one to the neglect or the exclusion of the other, you end up with negative consequences. And I particularly like the idea that this is like breathing. It's not like you have a choice between inhaling and exhaling. You must do both. Let's see. I'm trying to move my, oh, there we go. Okay. Now, an example that I'd like to provide is with polarity is if we look at utilitarian versus justice ethics, for example, or if we were to look at rights versus common good ethics. And I chose those two because they are relevant to the COVID situation. Utilitarian ethics has a big role in things like resource allocation and triaging when there are limited resources, and rationing when there are limited resources. If you think about personal protective equipment, limited experimental treatments, limited ICU beds, vaccinations when they first came out and were somewhat limited, you have the question of how do we make those choices about who gets those limited goods? Is it a utilitarian approach where you say the most good for the most people, Or do you say, well, we have to make sure everyone is treated fairly? And in this case, how do you define what is fair, and how do you define how that fairness ruler is applied to actually choose people to receive the ICU bed or the PPE or the vaccination? Another example, as I say, is ethics of rights versus ethics of common good. And that's really at the crux of many of the issues that have cropped up with COVID. The balance that you're trying to find between honoring rights of individuals to make decisions against the need for common rules to maximize the common good of the entire community. And this has been confusing for people. It's been polarizing for people. In part, it's been confusing because so much has been not known about the disease or how best to deal with the disease. So we've been rolling along, trying to understand as best we can what it all means and what's the best way to approach it, even as we're trying our best to save as many lives as possible. So it's kind of been dealing with a moving disaster in real time. So that's an example of how polarities force you to look at both sides to try and find some way of accommodating what's right about those sides and not fall into the traps that occur from being too far on one side versus too far on the other side. Another example, when we look at values, for example, is, and I bring it back to values because, as I said, values tend to underlie what people believe to be ethical in action in the world. So let's take a couple of values like honesty versus loyalty. They are both good values. You would want to believe that you strongly adhere to both of them. You're an honest person and you're a loyal person. But when push comes to shove and you had to decide and choose between honesty and loyalty, which would you pick? For me, it would always be honesty, because I still remember the voice of my mother in my head from when I was a child telling me no matter what I did, it would only get worse if I lied about it. So honesty to me is bedrock. For other people, loyalty is more important than honesty. Being loyal to family, friends, clan, tribe, whatever, is paramount, and you can fudge on honesty in order to secure that loyalty for your group. Another example is freedom versus security, and again, this is at the crux of COVID. Freedom of personal choice versus security of trying to maximize the healthy condition of the community. Before I move on, what I would like to say is that when you have these clashes of approaches to ethics, when you don't necessarily agree on the approach to ethics, you're not going to answer the question, what is ethical, in the same way. And another important thing to think about is that the level at which it is applied makes a difference. Are you making this decision for yourself, for your family? Or are you talking about somebody who is in the position of having to make a decision or an action for a community or for a nation? And so this kind of shows the difference between individual decision-making in ethics versus public policy decision-making, where you're permitting or prohibiting some action for the common good again. So when values clash, this I find this position here to be very important to keep in mind. When we have genuine clashes of values, deeply held values, we should not be asking which side is right, but instead we should ask, what is each side right about? Because chances are they are right about something. And if we recognize that it's not a matter of right or wrong, but what is right and what is right, then we're going to have in our minds a mindset that says, let's try to find the best balance between those contending values. How can we best honor those values on either side of this clash? How can we identify what are shared interests that lie beneath what seem to be opposing positions? And can we work out some sort of a common vision that leads us all towards a better future, as opposed to dwelling solely on what it is we disagree about? So moving into applied ethics in healthcare and public health. Over the years, an approach to ethics in healthcare has been developed and honed and spread widely. It's called principlism. And it basically says that these principles of autonomy, beneficence, non-maleficence, and justice are common enough across competing frameworks and moral bases that we could generally agree that these are principles that we should use to make decisions in healthcare. So autonomy really is respect for people, respect for their individual rights, their free will, their ability to make their own decisions. And in practice, that involves informed consent, keeping confidentiality about their affairs. It also involves telling the truth to them and keeping promises to them. We're not lying or obfuscating to trick them into doing something that is not of their own free will. Beneficence, good, and it is one that is at the core of healthcare professionals. It's similar to, but sort of more proactive than the non-maleficence, which says do no harm. So do good is more positive than do no harm. But the do no harm really comes from the Hippocratic oath that physicians take when they enter the profession. Then there's justice, which is fair allocation of the benefits and burdens of a situation, and different flavors of justice: utilitarian, based on the greatest benefit; market justice, based on ability to pay, which is a common one in our culture and society; social justice, based on need. Are we being fair in sharing benefits and burdens based on the need of the people involved? So again, if we look at this in terms of a polarity where one of the approaches or principles is seems to be in conflict or conflicting with another one. And here I'm showing autonomy versus benevolence, non-maleficence versus justice. And I do that because autonomy tends to be a very dominant position in healthcare in US society. It tends to be the one that gets the most play and the most attention, even though we're supposed to be balancing all four of these principles against each other. And then some examples from the COVID world is autonomy is my right not to be vaccinated versus beneficence, a professional's duty to care for people who are unvaccinated, even though it may be harmful for them. Autonomy versus non-maleficence, my right not to wear a mask versus non-maleficence, not wanting to endanger other people, for example, in public spaces. autonomy versus justice, my right not to be vaccinated versus the allocation rules that have been used in vaccination, where they say those who are younger and healthier but unvaccinated have some greater right to treatment, to medical treatment, than people who are older, more feeble, but vaccinated. That's a topic that has come up a couple of times, and I think needs to be addressed in more detail, in more deep discussion in our society. When you look at public health ethics, the same principles, autonomy, beneficence, non-maleficence, and justice, are used in public health ethics, but there's definitely a social bent to it, a collective bent to it, as well as a utilitarian flavor to it, the greatest good for the greatest number of people. It tends to be, public health ethics tends to be population-based, looking at the population, the community as a whole, as opposed to individual patients or individual providers. And it's also policy-driven, which also means that it wanders into the world of politics, because policy is what government settles on in order to guide actions for the community. So the big polarity here in public health ethics, is the one of free will or autonomy versus common good. I have in parentheses, or paternalism. And the things I'm thinking about are, for example, the difference between a safety seatbelt law and a drunk while driving law. A seatbelt law says you must have your seatbelt on because it'll help you survive an accident. It's good for you. A DUI law says you shouldn't be drinking and driving because not only could you kill yourself, you could kill others as well. So that's kind of how I look at the difference between paternalism, it's good for you, versus common good, it's good for everybody. So public health ethics is the standards and values that are used to guide actions to promote the health and well-being of a community as a whole. And again, it's looking to introduce policies and practices that will be of the greatest benefit to the community. When you think about public health and some of the challenges they've with over the years, the decades, the centuries, you've got all sorts of diseases, plague, cholera from way back, smallpox, SARS, MERS, swine flu, Zika, all the way up to our current COVID-19. And, that's even skipping over a whole bunch of other ones like polio and HIV AIDS and those sorts of things. Then you have on the disaster side, hurricanes, floods, tornadoes, wars, terror attacks, bombings, and a big one for all of us these days, climate change events that we need to start planning for and figuring out how we will survive. So in epidemics, they bring about the shock of having to deal with an epidemic or pandemic brings about new discoveries, health discoveries, as well as behavior discoveries. What is ethical behavior? What is appropriate behavior? And what is normal behavior in society given this new epidemic? And at the heart of it is, as it says here, the ethical determination of the decision-making responsibility, specifically balancing the respect for individual freedom and liberty with the responsibility of governments to provide citizens with some degree of protection in their health. And again, there's this push-pull, this polarity. On the one hand, public health officials need enough power to be able to put forth these policies and guidelines for community behavior. But if they hold too much power, they could endanger the human rights of those people, and with potentially long-lasting negative consequences. the ethical principle of respect for persons, also known as autonomy, says that people have the right to have their own beliefs and values and to hold to decisions and choices that they make that further those beliefs and values. But things can go awry if those individuals do not feel a moral responsibility for society and their personal behaviors begin jeopardizing the well-being of others. This last bullet point is critical because it says, according to these authors, there are no fundamental conflicts or inconsistencies between autonomy and the role of government, as long as it does not go beyond the limits set by the governed. And that is critical because the governed are the ones who say, is it good? Is it the governed are the ones who say it is acceptable or it is not. And a lot of what we're going through today has to do with a serious, severe, deep disagreement about that. I'm trying to advance my screen again. There we go. Now, in order to be doing what one should do in public health, they need to make serious decisions ahead of time that have both to do with logistically what is going to happen or what should happen, but also ethically what should happen. Again, as public health looks and says, in planning for a disaster and planning for an epidemic, we need to balance those utilitarian, what's the greatest good for the greatest number of people, against deontological views. That's just a fancy word for saying rights, duties, and rules. There's a right way to do things, regardless of the greatest benefit for the most people. We need to think about those that are most vulnerable, the elderly, the ill, the disabled, and say we may have to provide greater resources for these people because they have greater needs in dealing with the epidemic or the disaster. And it is inappropriate to sacrifice some people over others, even if it means that we don't reach the greatest good for the greatest number. There's a need for triage or making decisions about resource allocation when resources, interventions, treatments are limited. And we may need to alter the standards of care when we reach that point. But it always comes back to this balance between individual autonomy and common good, and then this balance between individual autonomy and personal responsibility. Where does autonomy stop and community protection begin? Okay, now to look at a little bit more detail about what's been going on with COVID, and I'm trying to be mindful of time. There are so many issues involved with COVID that this was one way of trying to bucket them. There are many other ways to bucket them, but this would just seem to be one way to sort of simplify this whole pile of issues. But as you can see, it is a pile of issues. If we look at autonomy, there's the quarantine, lockdown, social distancing, masking. And this area is probably the best example of how ethics has been in conflict, or different ethical approaches have been in conflict during COVID. Some people say we absolutely must quarantine, lockdown, distance, mask in order to curb the spread of the disease, in order to save people. Other people say you are impinging on my personal rights to act and move as I wish to do so. Testing, treatment, and vaccination is another thing. What is your right to choose to test not, to be treated or not treated, to be vaccinated or not vaccinated, the whole issue of vaccination certificates, people concerned about HIPAA privacy, people misunderstanding HIPAA privacy. HIPAA privacy doesn't mean you can't share your information with anybody. It means other entities cannot share without your permission. There's concern about surveillance, particularly when there was a lot of contact tracing that was attempted, not very successfully. And then under informed consent, one issue I raise is how informed can choices be by individuals if they are completely surrounded and overwhelmed by uncertainty, by confusion, and frankly, rumors and lies. How can they make reasonable decisions if they are not informed about what is the best knowledge of what is going on and the best knowledge of what is recommended to do? So how can you have autonomy when you don't have certainty and truth to help guide your decision making? When we look at beneficence and non-maleficence, there's the whole issue of the experimental treatments and the rapid vaccination development that has caused a lot of hesitancy on the part of some people about the vaccination. One interesting tidbit that I read somewhere along the way, I'll have to track down the source, is that when they looked at who was vax-phobic in the US, there were two clumps of people, those with high school educations and those with postgraduate educations. And that says something, that both of these groups have a heavy predominance in the vax-phobic group. There's the question of certainty in science. And science is not certain. As they say, when they're talking about forensic science, it says, scientists might refer to personal degrees of confidence in a finding or to the degree of controversy surrounding it, but there is no generally accepted or working definition of a reasonable degree of certainty in scientific discourse. So on the one hand, people want certainty in science and demand it, even when it's not available, and then use that uncertainty to justify what they choose to do. There are also big issues with trust in authority, either based on historical happenings to certain groups, due to politics getting involved. So there's been a huge array of things that have led to concerns about vaccination. And I guess my point in bringing this up is not to dismiss those concerns, but to address them forthrightly, and not just to assume that they occur from, gross ignorance or something. There's the issue of exposing essential workers and healthcare workers. That's also an issue of beneficence and non-maleficence. Before the vaccine, when everyone was equally at risk, there was masking, distancing, the healthcare people were heroes, the frontline workers were heroes. After the vaccine, some of those workers, essential workers themselves, refused to be vaccinated. Others continue to be on the front line, are vaccinated, and then can still fall prey to the disease. So it's this whole question of how do we protect these groups of people who sort of have less choice about their exposure to the vaccination. And then there's this particular group of unvaccinated patients, and the unsettled question, even in bioethics, about what are the moral obligations of healthcare professionals to treat unvaccinated patients. Do they have a right to say no? Or are they required by their professional moral obligations to treat them regardless? Then under justice, there's the whole issue again, of triage and rationing. There's also the issue of people being privileged in being able to have better access to personal protective equipment, better access to running off to the countryside so they can avoid the crowding in the city and therefore avoid or lower their chances of exposure. And there's things like people cheating, cutting in line in order to get access to the restricted or the limited resources. And at one point that was vaccinations. Now it's things like boosters. Now it's things like rapid home tests to clear you to do things. The whole issue of the aged and disabled, again, triage and rationing by age and by ability to survive a severe disease. That's a serious issue of justice that has been somewhat settled in practice, but I don't think to the satisfaction of the parties involved. Social determinants of health, underlying conditions, vulnerable groups, those who could work at home versus those who must work in the front lines, parents and the children who are not able to get vaccinated. Again, these are all issues of justice. And again, geographic disparities, urban versus rural, or for that matter, international, where one example is when COVID guidelines were saying distance, you must distance from each other. Well, that's hard to do when someone is living in a very poor, crowded environment where distancing is not possible. It's not even a luxury, it's not possible. Another issue in the international scene is it really right for all of us to get boosters when a vast majority of the third world haven't even gotten their first vaccinations yet? And then there's employment-tied health coverage, where you run into issues of have and have-nots depending on whether they have insurance tied to their employment, whether they lost their job and therefore lost their health coverage, whether they could then get on Medicaid or had to go uncovered. So that is a whole other cluster of issues related to justice. So as you can see, I take a very swift run at these ethical issues in COVID because there are so many, and they almost all are thorny, difficult decisions or difficult conflicts to try to address. And unfortunately, I do not have a magic bullet for these. But as I said, it's been clear to me that the whole COVID pandemic experience that we all have suffered through over the last 2 years has been just fraught with ethical issues day by day by day. And hopefully at some point we will be able to digest them and deal with them so that we can deal with them better next time around than we have this time around. So that leads us into looking ahead. We need to expect there will be more pandemics. And to be better positioned for that, we should be looking at addressing health disparities, addressing the shortcomings of our healthcare delivery system. And I believe we need to learn to respect the differences that we have in values as human beings. And we need to work harder at fostering the truth and trust so that people are not turning away from doing good, rational things, either because they've been lied to or because they don't trust the source of the information. So in terms of expecting the next pandemic, this is from a book by Gregory Pence. He wrote a book on pandemic ethics just in the last year. And I'll be sharing a little bit more about that book a little later because it's a wonderful resource. But he's basically saying that pandemics are not going to go away. First, there's global warming, which is going to lead to more diseases. because of the conditions that global warming creates. Next, we have a population of people that is exploding with more crowding, with more burning of wild areas to farm, and more interaction with animals, wild and domesticated, which are all creating conditions for new viruses to hop from wild animals, domesticated animals, to humans. And finally, we're increasingly connected through shipments around the world just in time. And these shipments allow the hybrid and travel, international travel, allow the viruses to spread quickly once they start going. We need to address health disparities. We've known about a number of them for a long time. And we've known that health and social inequities create huge problems for people who are marginalized. And in the case of COVID, it has made worse some of those inequities related to, for example, race and ethnicity, socioeconomic status, being homeless, being disabled, being an old person. In other instances, COVID has revealed or created new inequities having to do with education and employment. Again, the able to work from home versus got to work on the front line because I still need to support my family. So we need to address those health disparities. Again, easier said than done, but it's critical. We need to adjust our shortcomings. These are some quotes from some political type people. Kamala Harris saying, at the same time the world works to get through this pandemic, we also know we must prepare for the next. We know that the status quo is not nearly good enough. UN ambassador, the world barely withstood this pandemic. We must be ready for the next. And Representative Dingell saying, we're beginning to understand more clearly how broken our system is, and we need to take this opportunity to make change. In healthcare, some of the big challenges are, again, employment-based healthcare insurance. It's fractured. Healthcare delivery system is fractured. In order for healthcare institutions to better prepare for the next COVID, they have a duty to plan, to understand that there is uncertainty, and to plan for that uncertainty, both again at a logistical level and at an ethical level. What ethical challenges are we going to face next time? And how do we make sure we're as on top of them as we can be, instead of just making decisions in the throe of the moment, the panic of the moment? We have a duty to safeguard workers and vulnerable people. And we have a duty to guide, which is to plan ahead for limited resources, to say, how are we ethically going to ration out care if and when we need to. And we need to understand that in emergency situations, the quality of care may in fact be compromised, because it must be, in order to try and get as much care to as many people as possible. When it comes to public health and the shortages there, the challenges there, as this one excerpt says, there have been numerous health emergencies before COVID that have raised the problem of needing a more robust public health system. And in response, there's been occasional one-time funding to slap a Band-Aid for that particular crisis, and then nothing done on a systemic level to address the overall chronic underfunding of the public health system. And every time we just kick the can down the road, it leaves us less prepared for the next emergency. And without increased and sustained funding for public health, we will not be as effective as we need to be the next time around. Now, when it comes to respecting values, we need to understand and respect that other people have core values that may very well be different from ours. We need to try to identify those values so we can understand that person better. But we really have to respect that they hold those values in earnest and not try to demonize other people because their values are different. The second bullet point is really referring to the 6 core values that were identified by a German philosopher and psychologist, Sprenger. The core values he identified were utilitarian, individualistic, theoretical or learning, social, traditional, and aesthetic. And they have a lot of overlap and commonality with the values that we discussed earlier. So his proposition is that all of us hold 1 or 2 of these values very strongly. We're indifferent to some others, and others we actually don't like at all. So if we're trying to make mutual decisions, if we have our top values are congruent, it's easy to come to an agreement about the decision, the choice, the action to be taken. If there's disagreement in those top values, it's harder. It's hard to even communicate, and we start labeling each other as difficult. I just don't understand them. They're, and then we lead to demonizing. So what we have to do is we must accept that some people have different values, that we are not able to change those values. And those values are not inherently wrong, they're simply different. And so as we look at common solutions to common problems, we have to consider others' values while not giving up on our own. There's a process called values-based decision-making, which is suggested for organizations when they're dealing with things that are less clear-cut and more having to do with values and clashes in values. And first thing is to clarify the perspective and understand what point of view do I bring to this situation? And how do we clarify what those differing views and perspectives are so we understand that they are differing, and what are they, and how are they positioned against each other or with each other. We need to understand what are the values that are important to this situation and to other people who are affected by this decision. We need to consider what are the most important values for this particular situation, this decision, that should guide the decision making. And then once we've identified those, we can look at the different options and say which options best fit those values that must be adhered to or must be respected in the decision making. And then that last step, communicate decisions clearly and honestly, is one that I think in some cases gets forgotten. And you very often with people, you can't just say, this is the decision. You need to say why. What went into that decision? Not just the facts, but the process of sifting through those values and trying to determine which values merit the most emphasis in this particular situation. And I think too often the communication of decisions is glossed over and done too quickly without the understanding that people really do need to understand the why, not just the what. And then finally, fostering truth and trust. When I put this together, I was thinking, well, what does truth mean? What does it mean to be truthful? Well, it means being honest and not telling lies. Trustworthy, what does it mean to be trustworthy? That you're worthy of confidence. You can be depended, you can be trusted, to be telling the truth, to be honorable, to be doing what you believe to be right. As Gregory Pence says, when struggling with pandemics, one particular virtue stands out as important for good leaders, their trustworthiness. Pandemics require swift responses, sudden changes in normal behavior, and a need for cohesive group action. All of these actions require trust by the public that their politicians, scientists, and experts do not mislead them, but guide them to safety. This virtue of trust is like health. You take it for granted until it's gone, and then you miss it terribly. And I would say we are missing it terribly at this point in time with the COVID pandemic. Then he goes to say that trust is also behind communication, human communication, which then leads to truth. If most people routinely lied most of the time, nobody could believe anything easily, and human actions would be curtailed. And he brings up the point of the politicizing of the whole situation with COVID, when every fact is politicized by politicians and the world sees each portraying itself as angels and the other side as devils. A country cannot unite against a virus. And that has been a big problem we've had. One country that seems to have done, I know it's not the only country, but one that sticks in my mind that seems to have done a good job is New Zealand, where they seem to have been able to gather together in collective action in a way that has been beneficial for their country and their populace. So again, lessons from COVID. If we want to be better prepared for that next pandemic, we need to address health disparities, healthcare system shortcomings, somehow learn to respect others' values, even when they're different from ours and contra to ours, and work much harder to foster truth and therefore trust in what is being shared amongst us. And I know this is a tall order, but we have to unite or we will face new devastating pandemics in the future, probably a lot sooner than the 100-year gap between the Spanish flu of 1918 and COVID flu or the COVID pandemic of 2019. It's going to come much sooner than that. And when that next pandemic comes, will we have learned and will we have made sufficient changes to improve this situation, or are we going to have a repeat of the last 2 years all over again? And with that, this is the book that I was referencing earlier. Gregory Pence, he's a bioethicist, and he wrote this book just in this earlier this year, and really does a very nice job of discussing a lot of the issues, the ethical issues of the pandemic. And what I'm hoping is that in, say, another year, when we are hopefully a little further away from this whole mess, that he will expand on it and start looking back some more at what has occurred, because as I said, he wrote this in early 2021, and of course much has happened since then, and I would really value his look back in a year or two. So that is the end of my presentation. There's a whole bunch of references there for anyone who's interested in digging further. And as I said, Gregory Pence, I thought did a wonderful job. And other than that, I will stop sharing. And I know we have at least a little time left to field some questions.
All right, thanks.
So,
Thanks, Linda, for that presentation. Just as a reminder to the participants on the call, please feel free to jot your questions in the chat box or the Q&A that you have for Linda. I'll also make sure to share those references in the Mahalo email with you folks. And I believe that actually was included in her slides that she has for today. And we'll share that with you folks on the call. So let's see, any questions? I don't see anything right now. Someone did have a comment that they didn't necessarily agree that the seatbelt laws are paternalistic. They do, in most circumstances, protect the individual, which is the good for you type of laws, but they mostly protect others who are in the vehicle with them. Without a seatbelt, your body would fly about in the cabin of a vehicle and cause more injury to yourselves and others, especially causing head trauma to all involved.
well, I certainly, yeah, I agree with that, and I stand corrected. And also, I think another thing that has been used for seatbelt laws is, of course, the traumatic injury that people sustain and the trouble and cost that's taken on in order to treat those people who could have avoided that injury by having their seatbelts on. But yeah, I can appreciate that.
We have a question. How do we rebuild trustworthiness with sections of the population that are regularly being fed misinformation? How do we build trustworthiness among academic communities as well? They've seen a lot of conflict between engineering communities and health communities, for example.
Well, I unfortunately don't have a magic answer to that. Trustworthiness and truthfulness is something that has to be practiced every day at every opportunity, or it slips away. I think it also goes down to in some ways sloppy communication, but that's being a little harsh because all communication between people is difficult, and it is so easy to have misunderstandings or mishearing something, not interpreting it the right way. So for example, when you talk about the engineering versus the healthcare communities, they have sort of different mindsets about life and about what is a fact, and about so many things that it's easy for a miscommunication to happen. So part of it is trying to be clear in communicating, trying not to use too much of your own jargon that either other people don't understand, or other people misinterpret, or other people have different definitions for the words that you're using. So it's carefulness in communication. And then it's a lot of it is, are we acting with good intentions? There will be miscommunication and misunderstanding, even with best of intentions, and we need to work to get beyond that communication barrier to touch the minds and hearts of other people. But when we don't have good intentions about what we're saying or sharing, like those who share rumors and those who spread lies and those who feed confusion because they have their own purposes for doing so, then we're fighting against ourselves because the good intention is not there. So I just wish more people would just, act honestly and with good hearts as we go about our days, and not feed into the misunderstandings that are plaguing us these days.
Thank you. We have another question. Please, could you offer an example of how multidisciplinary teams integrated with use of consultation with professional spiritual care providers support with COVID ethical dilemmas?
I need to see that one. Can you bring that up on the screen?
Sure. Actually,
Oh,
it's in the chat. Yeah, it's in the chat.
There it is. Okay. Well, spiritual care providers are critical in the use of ethical consultation, because not every part of the decision that's being made is based on the biology or the medicine or the science. So much of it is based on people's very firmly held personal beliefs, often religious beliefs, spiritual beliefs. And so to just keep trying to hammer them with more medical facts or medical opinions without addressing the spiritual need that is part of who that person might be, you aren't going to fully communicate with them. People are not just rational beings. We are beings of belief and spirit and faith. And when those are a large part of who a person is, to ignore that is to do a disservice to who they are and what's important for them as they make decisions or as decisions are made for them. So you should have that spiritual component in those discussions when you're dealing with those ethical dilemmas, particularly if spiritual matters are important to that particular patient or family.
Mm-hmm. Thank you. Another question we had was, what type of things do you think we could do to help our country move forward in making good policies about the COVID-19 virus without the politicization? How can we get everyone or most people behind the idea of minimizing the health risks of COVID-19 by all working together?
I think we need consistent, clear messaging. I think at least part of the problem has been because COVID has been a moving target and because knowledge of COVID has been building as we've been moving along with this pandemic, there have been false starts and contradictions and changes in recommendations or changes in what's believed to be the right thing to do. And a lot of that is perhaps unavoidable because of the changing nature. But to the extent that consistent messaging based on, the best known science at the time, combined with an appreciation and a respect for those who have other values and perhaps have mistrust, we have to hear what they're saying in order to try and better communicate with them. It's not just a matter of being nice about it. It's if you don't connect with those people and understand where they're coming from, they won't hear you. You just are not able to get past that barrier. Let's see, do you see a conflict between those who believe in absolute morality versus relative morality? How do you see this affecting public health response to emergencies? Oh, that's a bit deep. Public health is in a position where you are trying to make calls, you're trying to make recommendations or decisions for the good of the community, with a community that has many, many, many different viewpoints and beliefs. And so public health will always be in a tough place because of that lack of unanimity in the public. And that's simply because that's how we human beings are. So whether there's absolute morality or relative morality, public health has to do the best it can with knowledge and with respect for opinions to make good calls for the community as a whole. And I don't think there's ever going to be a situation where you will make everyone happy. I think it's just the nature of the beast. But it's making the best calls you can and being able to say, this is why we made this call. This is why we believe this is the right thing to do. And to have good intention in doing so is and then communicating it well so people can understand as best as possible is probably the best you can do. But as I said, I really don't think you would be making every single person happy, because we're just all too different and we have such conflicting beliefs and values in many cases. But as I said, going back to at least hearing what that other side is saying, I think is critical to making any progress. So I know that's kind of a wimpy answer, but that's probably the best I can do. Is there any other questions someone wants to throw at me?
Yeah, any other questions that folks have for Linda, please feel free to drop them in the chat, in the Q&A. We're kind of early, but that's okay. I think we've got a lot of information that was shared through this training. So we'll give it maybe a minute or two left if folks have any more questions. And if not, if you want to, if we have some more time, if you want to part some last thoughts and some, last minute thoughts and ideas to the participants that are still on the call, feel free to do that, Linda.
Well, I will say this, that when I started getting into bioethics, gosh, probably 20 years ago, I was looking for tools that would help make better decisions. I started off in corporate planning, of all things. So I was looking at how do you make better decisions for an organization? And there's always the financial part of things. What do the dollars and cents say? What do the numbers say? But that doesn't tell the whole story, of course. And then I started getting into both planning and sort of policy analysis. What are good policies that an organization might develop and abide by in order to guide action? And so I started pulling in some of the thoughts there for decision making for policy. And then as I got sort of involved in some issues in healthcare that had ethical components, such as end-of-life care and services for aging people and stuff like that, I started saying, okay, what about the ethical aspects of these kinds of situations and choices? And so I started digging into that and took a couple of courses, and then ended up getting my master's and ended up getting my doctorate, always looking for more tools. And at the end of it all, I did not come away with a lot of certainties about what's right and wrong, good and bad. But I did come away with a way of looking at these situations to try and tease out what might be a better way through the situation. Not necessarily the best way, not necessarily the only way, but hopefully a better way. And as I said, one that I could explain to others. This is why I believe this is the course of action we should take. And it's that deliberation and that thoughtfulness and having some knowledge of these theories underneath it all, but being able to say there are multiple views of the situation. There's not just one view. And given these multiple views, multiple values, how do we try to wrestle together, again, with good intention, to come up with what we believe to be the right course of action for this situation, for these people who are involved? And that's what I think ethics is about, and that's what I think bioethics it should be about in healthcare, in public health. And it's that mindset of trying to understand the facts, trying to respect the views, opinions, and then trying to work together toward a mutually agreeable way forward is what we need to try to do, because I don't think there will come a time when we're all going to be in agreement about things. And unfortunately, we face and will continue to face these sorts of challenges in life ahead, and certainly as society gets more complex and everything else. So that's it. I just hope that I've shared some of that with you to give you something to think about next time you're, faced with some sort of what seems to be an intractable conflict or problem in front of you. So
Great.
that's it.
Great. Thank you, Linda. And thank you. We were able to cut it a little short today. I think we were able to get as much information out. So I want to thank everyone. First of all, I want to thank Linda for being our guest speaker today. Thank you so much for taking the time out of your day and joining us on this Aloha Friday. Again, be safe, be well, stay happy, and stay safe, everybody. Hui hou. Have a good day.
Thank you. Thank you, everybody.